Hello everyone. Meet Tom. Usually he is nothing but smiles, but recently he's been feeling a little under the weather. He is headed to his local health clinic for a checkup. He is taken into a clinic room, and after examination, the physician suspects Tom has streptococcal pneumonia infection. Before prescribing, the physician consults Tom's electronic medical record. He uses this to review his medical history, so things like previous illnesses, infections, and associated treating antibiotics. He also uses it to access Ontario's antibiotic formulary to see how many antibiotics are approved for treating streptococcal infections. It identifies a list of 15 antibiotics, and to help guide him to the best decision, he uses the electronic medical records clinical decision support system. This is a tool that links health knowledge discovered by research, physician observations, and accessible patient histories with respect to treatment guidelines to improve physician therapy decisions. After analysis, the clinical decision support system recommends amoxicillin as the best choice of treatment. As the days pass, however, Tom doesn't notice any improvements in his condition. If anything, he's feeling worse. Worried over his deteriorating health, Tom takes a second trip back to the clinic. There he discovers that his streptococcal infection is still very much present, seemingly resistant to the amoxicillin. This time, the physician decides to review an antibiogram, a standalone electronic report summarizing the local prevalence of bacterial sensitivities to specific antibiotics. Unlike a clinical decision support system, which analyzes literature and makes recommendations for the physician, antibiograms are analyzed by physicians, a very timely but informative process. For example, it highlights bacterial percent sensitivities. The higher the percentage, the more effective the antibiotic is against treating a bacterial strain. The accuracy of this is dependent on the number of bacterial isolates tested. So, the higher the number, the more accurate the depiction. But if there is less than 30 isolates tested, the data is deemed unreliable for decision support. After manually reviewing the document, the physician finds that excessive use of amoxicillin has rendered it only 55.1% effective for treating streptococcal infections. He does find, however, that the antibiotic cefixime to be 86.5% effective. With this information, the physician gives Tom a new prescription for cefixime. A few days later, Tom's infection clears up. He is no longer feeling sick and tired, but happy and healthy. Tom's story is not unique. The Center for Disease and Control Prevention estimates that nearly 2 million people suffer annually from severe infections as a complication of antibiotic resistance, and almost 23,000 people die as a direct result. It has become one of the leading global issues in a healthcare setting. In 2003, Public Health Ontario established an antimicrobial stewardship program which seeks to achieve optimal clinical outcomes related to antimicrobial management by monitoring antibiotic regimen, dosing, duration, and route of administration. The plan, however, lacks proper execution. In prescribing antibiotics for patients in a healthcare setting, the current established approach has two separate systems: the clinical decision support system and an antibiogram. Though popular, existing clinical decision support systems only provide recommendations and not assessments at the time and location of the patient encounter, while antibiograms, a convenient tool detailing local antimicrobial susceptibility, are largely underutilized within the realm of healthcare. This is because of the copious amount of time and clinical knowledge required for analysis. Finding a way to augment antibiograms with clinical decision support systems would help improve patient outcomes by having antibiotic recommendations based on literature evidence that is reflective of current local antibiotic resistance trends. The question we are faced with now is how we propose a solution to automate and embed local antibiograms into the database of a clinical decision support system of a hospital's electronic medical record. This is to create real-time input on current antimicrobial resistance patterns and antimicrobial use. The uniqueness of this solution is that the clinical decision support systems will exploit locally generated antibiograms to provide the most up-to-date evidence when recommending antibiotics. The proposed solution is not only technically feasible, but also semantically. A survey conducted in 2016 by Public Health Ontario identified that of the 58 participating hospitals, 91% of them routinely built their own antibiograms. And many Ontario hospitals already have a functional clinical decision support system that supports physician e-prescribing modules. So what is the significance of these figures? Well, it ensures that most of the hospitals already have the foundation needed for a structured knowledge exchange channel. Moreover, physicians are already familiar with electronic medical records, clinical decision support system, and antimicrobial management techniques. What this means is physicians will require little to no training during implementation, so the degree of resistance in adoption is low. We suggest the proposed solution be customized to operate in the following sequence. 1. Define a list of antibiotics that are routinely used for empirical infection treatment within the institution identified. 2. Define a list of cultures and susceptibility patterns conducted by an institution's laboratory department. 3. Update susceptibility patterns for all antibiotics continuously over time to reflect real-time decision support. 4. The antibiogram data will be used to feed the clinical decision support system to evaluate antibiotics against the data derived. With this, the system can provide a decision in support of an antibiotic or suggest an alternative. So now, antibiotics can be prescribed empirically to patients based on susceptibility patterns identified from literature and locally compiled datasets. Implementing this pre-prescription solution will enhance patient safety, decrease length of sickness, and reduce healthcare costs associated with inappropriate antibiotic prescriptions, with projected savings to be in the hundreds of thousands of dollars. Just imagine all the good that could be done by investing that money into other healthcare innovations. But most importantly, this proposed solution aligns with global health goals to prevent the emergence of antimicrobial resistance, ensuring better health for all. Thanks for listening. Hope you enjoyed our video presentation proposing antibiogram-guided clinical decision support systems. Feel free to like or drop a comment to let us know what you think. Goodbye and good luck to you all.